位生技聊医聊的观众朋友，大家好，我是资深生医产业协同主持会计师黄佩娟。自从人类基因体计划解码完成以来，基因检测的临床应用已经成为成长最快速的医疗领域之一。本集生技聊医聊将分享 PwC Australia 医药、医材与生命科学负责人 Nick Meadows 在7月26号亚洲生技大会开场论坛的演讲内容。Nick 以国际观点分析基因检测成本大幅下降后，全球精准医疗领域的发展趋势。接下来让我们观看精彩的影片吧。
Good morning, everyone. First of all, thank you to PwC Taiwan for having me today and to this conference. It's a privilege to be here. Also, very humbling to be standing here among such an experienced lineup of speakers, so thank you very much. So I've been very fortunate in my career, in both my academic career and my business consulting career, to work with both academic spin-outs, medical research institutes and large pharmaceutical and biotech companies in the topic of genomics. And so that's why today I'm going to talk about the sort of, I guess, the democratization and the sort of the genomics revolution that I think we're experiencing after many decades of research and investments in the field. So before I do that, I just want to reflect on some work that PwC has done, particularly around what we're calling the publication value in motion. And so that economic analysis looked at the large-scale reconfiguration of traditional industries today into new areas of growth in the future, broader, deeper value pools that are kind of changing the way that we look at traditional sectors. So if we think about manufacturing, we're thinking about how do we make things. If we think about healthcare, we're thinking about how do we care for people. And that's a really interesting dynamic, which I think most people will be familiar in this room. Healthcare is changing from episodic care in acute settings to continuous care and a focus on wellness. And genomics has a sort of really significant factor in underpinning that transformation. If we think about the care ecosystem today, many people will be familiar with the 3 Ps. Care is really moving towards a personalised, predictive and preventative mode of care. And you'll see that a lot of that, particularly on the image on the right, is being fueled by technologies and innovations that are really underpinned by genomics. We think about gene editing and therapeutics, precision medicine, regenerative medicine, all have deep ties with genomic information or genomic technologies. We're also seeing new business models arise. If we think about personalised preventive health platforms, we're seeing the convergence of wearables, AI, genomics to be able to provide that precision medicine element. We're also seeing new value-based partnerships where we can really start to truly see payers reimburse innovations for health outcomes over volume, particularly when we start thinking about reimbursing and rewarding innovations that encourage wellness. And then lastly, it may not be so much about genomics, but that's an example of new business models and new ways of delivering care are things like hospital-at-home models, where people are now receiving their care far in that sort of place of choice at home, away from institutionalised facilities like hospitals. So if we think about genomics underpinning that sort of transformation of the way we think about healthcare, it's been quite a journey. I think if we reflect on, there was a sort of small program started in 1990 around the Human Genome Program, which if we think about $2 billion later, 10 years later, we had around 2001, the draft publication of the first human genome. And if we wind the clock forward to I guess the next, what I considered the next big transformational moment in genomics was the UK's 100,000 Genomes project, which really took us to sort of ambitious components where we're moving beyond the ability to sequence one genome to the ability to sequence genomes en masse. And then the sort of translating that into how do we derive actually healthcare insights from all those genomes. And since then, there have been several initiatives across many different countries both large and small, all looking to, I guess, find ways to really superpower the research in genomics and start to integrate that into healthcare. And that's one of the things that I'm most interested in about today is how do we take that sort of genomics research component and integrate that into clinical healthcare. So one of the things that those national programs did was really supercharge a genomics market, which is going through rapid growth right now. And actually those programs, at least if you look at the 14 largest programs around the world investing nationally in genomics, over $4 billion is committed to investment in the next 10 years, which is creating enormous opportunity for biotechnologies and research programs. A lot of that is being driven by, I guess, the reduced barriers to entry. So we talked about $2 billion to sequence that first ever human genome. In 2001, that had come down to $1 million, but still fairly expensive if you think about clinical applications. But now if we think all the way into the 2020s, we're fairly pretty much underneath $500 to sequence a human genome. And actually, the sequencing cost is no longer, the barrier to entry to deriving clinical insight around human genomes. A lot of the focus now is on how do we use AI and multidisciplinary teams to interpret complex genomic information to inform clinical decisions. If we think about how that's presented itself in research, majority of the oncology clinical trials today are underpinned by a biomarker and a genomic-related biomarker. So we've gone from being able to do it to actually having a thriving sector with significant amounts of investment into genomics, and that means that there's opportunities in terms of sequencing companies, bioanalytic companies, and clinical companies around how do we actually help and support better health outcomes using this great transformation. If we think about genomics now in an accessible format to be able to integrate into clinical practice, there are a number of different applications which we're seeing today have significant application. And so the first one is screening and prevention. The ability to identify inherited diseases before they present, so we're talking asymptomatic conditions, means that we can minimize health implications and start to do preventative interventions to improve health outcomes. That can include things like genomic screening of newborns to identify specific treatable childhood disorders. And once again, the UK as an example has just implemented a program such that all newborns will be have their genomes sequenced. You can also target screenings to identify parents with genetic variants, which could increase their children's likelihood of having conditions like cystic fibrosis. So we're focusing on strong genetic germline components, hereditable diseases. If we move to symptomatic diagnosis and treatment, there's a faster and earlier opportunity to diagnose rare genetic disorders where there's often patients, particularly neonates in acute care, go for months, if not years, before they get a certainty around their diagnosis. That ability to do germline testing of hereditary cancers like breast cancer really transforms the ability to move towards that precision medicine, having the right therapy for the right patient at the right time. A lot of the innovation in genomics is moving towards somatic testing, particularly around acquired cancers to guide treatment based on different target genes. And I'll talk a little bit more about some of the innovation in somatic tumour testing shortly. And then lastly, in diagnosis and treatment, we can see the opportunity in pharmacogenomics, where we can use genomic testing to understand the way that patients will metabolize, absorb, and eliminate drug treatments within the body. So it informs the right selection of treatments for the patient. Treatment innovation is also seen in terms of genomic underpinning the actual therapies to which are often curative. Gene therapies, DNA editing, mRNA vaccines are all underpinned by our understanding and knowledge of genomics. We take the UK as an example of a country that's, I guess, sustained its investment in genomics since the Human Genome Program, where it was a significant participant. That investment's been sustained over decades, and it's probably run some of the largest national programs in both genomics and multi-omic approaches. Talked about the 100,000 Genomes program run by Genomics England. That program's now sequenced over 130,000 genomes. It's led to 700 plus research projects using this data, and identified over 1,500 disease variants that are now opening up the opportunities for diagnosis and treatment. The UK sort of built off that momentum with the UK Biobank, which extended the ambition around sequencing genomes to over 500,000 genomes, but importantly looking to source other tissues to do a kind of multi-omic strategy, and also more integrate into associating genomics and multi-omics with a longitudinal health record. So these programs now run over years so that you can understand the health outcomes and its relation to genomics. And that kind of culminates in our Future Health, which is kind of now the largest program in the UK, where over 5 million volunteers are being recruited to share health records, lifestyle information, blood samples and genomic data. I talked about somatic testing. Multi-cancer early detection tests are really revolutionising the way that we can diagnose cancers far, far earlier. The ability to detect circulating tumour DNA in blood samples well before any pathology or symptoms have been observed means that we can detect cancers stage 1 and stage 2 months to years before patients would typically have been diagnosed with a particular cancer. And the opportunity to move these tests into routine clinical practice really opens an opportunity to transform the way that we think about cancer, and to be far more preventative and predictive about cancer treatments. We go from the large to the small, but equally as important, I just want to reflect on a study in Australia that really highlights how you go from research program into clinical implementation. So the Victorian Clinical Genomics Service conducted a program within neonate genomic testing in acute care. And really what we find is that neonates in acute care often have months to years without a sufficient diagnosis. And what this program did was really routinely sequence the genomes of neonates in acute care with undiagnosed conditions, as well as other omic platforms. And that program really showed that over 50% of patients received a diagnosis in this program, the majority of those down to the whole genomic sequencing. And that, for 120 of those patients, that actually changed the way that their conditions were being treated through either surgical or transplant decisions. And that turnaround time was transformative, and if we think about the diagnostic odyssey that families and parents sort of have to go through when their children have this undiagnosed condition at such an early stage of life. And that evidence from that program was really instrumental in embedding and turning the genomic sequencing of neonates in acute care into routine clinical practice. But it's not all simple. And even with examples like the one in Australia, there's still challenges with clinical implementation. A lot of research programs and flagship programs have sort of start to finish funding, but the ability for those programs to continue as routine care are often inhibited by the cost of the genomics program and the ability to scale those across the broader healthcare system. So even in Australia today, less than 10% of genomic tests that are performed in Australia are covered by Medicare. And that means that those tests are being covered through state government funding as well as consumer funding. So that sort of is exemplified in some of these challenges. So there's limited translation of genomics research into clinical practice, and that's what's really important to democratise genomics. Healthcare systems have made significant strides in genomics research, but they need to be translated into clinical practice. There's variability in funding and delivery models. So particularly in Australia, where you have a divide between federal and state funding, you have these national programs that are federally funded, but as soon as you move into clinical implementation, state governments need to fund that, and then you hit a roadblock. And some of that is down to the restrictive reimbursement criteria. So traditional evaluation methods, which evaluate cost effectiveness, risk delaying adoption of genomic technologies. but they also failed to really capture the long-term impacts of genomics and health outcomes. So key capabilities for success that we've observed in a number of different countries implementing genomic strategies, the opportunity to standardize workflows and procedures for genomic services, remove that diversity in the way that those are being implemented. You need to redesign models of care to encourage the adoption of genomics early in diagnosis workflows, and you need funding for delivery and technology. We need really consistent and clear guidelines and policies for patient consent models. And we need to recruit and educate healthcare professionals that truly understand genomics. We need specialists in genetic counselling. And one of the lessons learned out of the Victorian Clinical Genomics Services was that you need about one genetic counsellor for every 240 patients that are receiving genomic services. And that really means you need to start investing now in terms of training genetic counsellors and bringing them into their healthcare system. And lastly, you need embedded infrastructure for end-to-end services of delivering the integration of genomics data and matching that with health record outcomes. Sequencing genomes is not enough. You need to be able to understand the insight and their correlation with healthcare outcomes over time. So lastly, there's even more opportunity beyond genomics, and many countries are now taking a multi-omic approach. So there's a market now for proteomics, transcriptomics, metabolomics. All those require new workflows, new capabilities and investment, but equally they provide opportunities for innovators, biotech companies who are sort of leading in those spaces. So I will pause there. I think the opportunity is bright. There's a great opportunity for companies innovating within genomics. Thank you.
非常感谢Nick Meadows的精彩分享。基因检测正反转传统治疗模式，使医疗朝向个人化发展。在演讲中 ，Nick 分享了各国对于精准医疗领域的投资。台湾在2024年将 NGS 纳入健保给付，帮助更多病患得到照顾。若有多元财源可以支持 NGS 等创新科技，长期渴望带动基因检测数据的累积，进而建立健康大数据资料库，增进台湾国际临床试验竞争力。谢谢各位观众的收看，希望大家都有丰富的收获。资诚生技医疗服务团队协助业者从设立、营运规划、募资、申请补助、建立制度到上市上柜、跨境合作、并购与永续发展等各阶段，提供财税、会计、法律及制裁等专业服务，提供客户最佳解决方案。若大家有任何问题，欢迎与我们专业服务团队联络，也欢迎大家上资诚官网或扫描 QR Code 加入资诚会员，订阅资诚生医透视，追踪最新生医全球趋势与资诚动态。谢谢大家今天的收看。